Uh, Back in March, we stood up the area command. So everything originated with public health, then went to area command. So this is kind of a recap of what area command and public health are doing kind of together and in conjunction with each other. This is the table of organization for area command. So you see at the top, you've got Mason County Commissioners, and then it goes to area commander. And we've been rotating that between Ross McDowell and Ryan Sperling. And then as you see, it kind of branches off into the typical 5 aspects of area command. But then below that, you've got logistics, planning, finance, medical ops, recovery ops, economic ops, and liaison. So initially we were meeting 6 days a week. We're now meeting just 3 days a week. And a lot of these things have kind of tapered off, or they've become steady states of business. So for example, Paige and Jennifer are just continuing to track all the expenses. It's a steady state thing. Recovery ops is where we're spending a lot of our time now in looking at schools, social services, mental health, food banks, transportation. Those are kind of consuming where we're at now. We're not as much in the initial response phases. We're kind of in a steady state and then looking at recovery. Economic operations, we're working with the EDC to handle those. Logistics, again, is through DEM. Christopher and I are working in planning, and Christopher is the one who put this presentation together. So this gives you an idea of it's a fairly complex bunch, and this is, I have to say, this has been I've had emergency operations before. This has been the best area command that I've worked with. It's been just much easier than others in the past. Okay, moving along. So initially we set up our mission to protect ourselves and citizens, contain the spread, secure resources, ensure rapid response. Number 5, keep the public informed, also became keep the public informed and unified, and then move the county into recovery. So we look at this, at each EOC to say, are we meeting these mission parameters in what we're doing? And then using this as our focus, and it's worked pretty well. So safety, obviously, it's something for us up there and really for everybody. So our safety messages come out of up there: personal protective and hygiene, distancing, cleaning protocols. So nothing new there. A lot of this is coming from the state and next to area command and out from there. So Lydia put together a comprehensive timeline. There's a lot of stuff here. I will send these slides out to the board so you'll be able to have this. But as you see, we instituted incident command on the 28th of February. And I think we're now on day 212. So this has been a lot for us over the past 7 months. And then as Lydia was saying, you get into July and into August, 107 cases over a 2-week time period. We're now actually starting to see that taper off. So we had an initial bump in April, calmed down through June and into July, and then bumped up again late July.
We get a lot of questions from people about COVID-19.
Short video.
Like, what should I do if I get exposed? How long should I stay home? To answer those questions, let's look at a few examples. This is Sam. Sam was exposed to COVID-19 on April 2nd when he saw his great aunt Marion. Since we know it takes between 2 to 14 days for someone who is exposed to begin to show new symptoms, Sam should stay home and watch for symptoms for at least 14 days. Common symptoms are cough, difficulty breathing, fever, chills, muscle pain, sore throat, and loss of taste or smell. Some people may also experience nausea, vomiting, or diarrhea. On April 16th, 14 days after exposure, Sam still showed no symptoms. This means he can now return to normal activities. Now let's look at another example. Sandra was exposed to COVID-19 on April 3rd. When she found out, she stayed home and watched her symptoms. 7 days later, on April 10th, she started coughing. 2 days later, April 12th, she had a fever. People with COVID-19 who have isolated at home can leave under the following conditions. no fever for at least 72 hours. That's 3 full days of no fever without the use of medicine that reduces fevers. And their other symptoms have improved. For example, when their cough or shortness of breath have improved, and at least 10 days have passed since their symptoms first appeared. To figure out when Sandra can leave isolation, we have to look at when her symptoms went away. Her fever went away on April 18th. 3 days later is April 21st. Her cough and other symptoms went away on April 20th. 10 days after her symptoms started is also April 20th. Of these 3 dates, Sandra has to wait until the latest date to leave isolation. The latest date is April 21st. That's when she can return to normal activities. For more information, visit the Department of Health website at doh.wa.gov/coronavirus.
Okay, moving along. So logistics, this gives you just an idea of what we've had, what's come through. We've had a ton of gloves come in, masks, surgical masks, cloth masks. And initially we ran through our stockpile of materials that we had on hand ready for an event. So those materials were used and now we've refreshed those. In the cloth masks, we received 92,000. I think we are at 75,000 or so that have been distributed. We're hanging on to, so those are a push out to the community. We're hanging on to the rest for pull. So as organizations need some, they'll call, ask for it. We'll send it out to them. Okay. So we've got a number of sources. We have had private donations. You know, early on, several dentists gave us a lot of PPE, and that got us through the initial part of the pandemic, was great relief to us. It was greatly appreciated. National stockpile, like I said, we rotated our stockpile, and then the state supply. And as yet, we're still not having to pay for those things we're ordering from the state, which is, it's been a lifesaver for us. So, and this one just gives you an idea of the volume of things that we've gone through. So face shields and gloves and gowns. And we order gowns, we order all this material, and we can't specify exactly what we're going to get. So sometimes we get surgical gowns, sometimes we get these very paper thin gowns. So we get what they send us, and then we do the best we can with it. Planning, and there's just so many things going to planning. This is a very busy slide. It's just giving you an idea that things are very busy. Guidelines. Guidelines seem to change all the time. We just got the latest guidelines on funerals and weddings. So as things change and new research comes in, DOH puts out through the governor's office guidelines and orders. So we've seen state health officer orders, we've seen Secretary of Health orders, we've seen governor's orders. So at DEM, we track all those and then try to get that information out as soon as we can, either in the daily sit reps or in the weekly reports through PIOs. But we try to get those out, I mean, as instantly as we can when they come out, because many of them have immediate effect. Okay, operations. One of the things we found out right off the bat is Mason County is multilingual. So we had some gaps in where we were at with languages, especially. We have Spanish speakers. We have a couple of dialects of Guatemalan that we've had to address in our planning pieces and in really in all aspects, planning and recovery and ops, economic recovery. So there's any number of those things that go into the operations piece. And public health has had all these great contacts for years and years through Lydia and her group that have these contacts in the community that we've been able to tap. Commissioners have had folks that we've been able to tap. And the county really came together with a lot of resources to make operations actually happen. So we early on decided that we couldn't depend on the state or any other entity to help us. Mason County would help itself, and we've done a pretty good job with it. Medical ops, this is, you think of Dr. Stein, Dr. Gushie at the hospital. This is a big part of their piece. Dr. Gushy is from Mason Health and advises us on our weekly EOC, actually 3 times a week EOC calls. Long-term recovery ops, Dr. States is working a lot of that. He's a volunteer that works with us. Again, you've got mental health and economic health, recovery task forces. Schools are part of that. How do we get kids back into school? What do the plans look like? What are the requirements? And how do we coordinate those efforts? Shelton School District had a committee together that public health sat on all summer, and we worked on putting the plans together. The superintendents worked with Dr. Stein and a higher level aspect of that same kind of work, and came up with great guidelines and plans for the schools, which went out to DEM and to public health for a review. So long-term recovery is where we're at now, and that will continue until this thing is over. Social Services Task Force, another part of that as well. And they're doing weekly meetings, a lot of telehealth. They're looking at some of the mental health aspects, as Lydia talked about. As we get into this and we have the social isolation happening and we have the physical isolation happening, depression, anxiety, mental health issues are climbing, domestic abuse has climbed, sheriff's office, city of Shelton PD are all reporting higher rates of those. So we're working on those pieces, working on education out to the community. Big piece of what's going on there, really a big piece of what public health is doing as well. And then again, right now, kind of things we're big topic, how do we reopen the schools? So right now they're on remote learning, except for the 2 private schools, which are doing in-person teaching. And we will watch those schools to see how that works out and kind of use them as our test case. It's nice that they're small and they can nimbly and quickly move if things happen. So where a bigger school system is a little harder to steer that boat around the corner. So economic task force, again, that's through the EDC, and they've been working on the stimulus package stuff and getting people out there, getting grants and that work. They've helped people with unemployment claims. Just a lot of work that's going on out there to get the money that's come to the county and that's come to the state out into the community. Finance section, that's Paige and her group over there. So you look at this, Mason County, and this is $1,756,000. Essentially, most of that is staff time. So that's a lot of staff hours, and public health is $159,000 just with the public health folks. So this has had an economic impact on public health in that while we are working on COVID related work and we're getting paid for it, we're not getting paid in our other programs, which we have deliverables in. So it's kind of a double hit. Yeah, we're getting paid, but we're not getting paid for the normal work. So Paige and Casey are working on keeping that financial piece on track. And this is the last slide, just to give you an idea of some of the partners we have. So we have the tribes and PUDs and all the fire districts. This has really been a cooperative effort across the county and even into the feds. We've had a lot of conversations with the Forest Service, Park Service, corrections. This has really been a group effort. We've had a great teamwork process through this whole thing. It's really, this is a community that is pretty tightly glued, and I'm very pleased with how this has gone so far. And with that, I'll take questions and I'll see if I can get out of this.
Dave,
Yeah,
I have a question.
sure.
I am not a medical person, so I can't give an answer clearly on this to when people ask it, but how did you come up with a 14-day quarantine time?
Okay,
Why not 13? Why not 15?
that comes from the CDC.
And how did they come up with that number?
So what they're looking at, it was typically symptoms appear from 5 to 10 days after exposure, and they've added the 4 days past that, so that came up with 14 days.
Very good. Thank you.
Any other questions for Dave? Okay,